Mackenzie Kreider. I'm a student at the University of St. Francis, and today in the Nursing Commons I'm going to do a postpartum assessment. Going into the patient's room, I would greet myself and tell them who I am. I would also wash my hands to start. I would check their ID band and to make sure I'm doing it on the right patient, and I would then go ahead to proceed to start with my assessment. On a postpartum mom, I would start with doing vital signs, so their blood pressure, temperature, pulse, and respirations. And I would also assess their pain. Pain is vital and needs to be assessed every hour with a postpartum mom. Then going through that, I would explain the process of what we were going to do, the Bubble H assessment on the mom, and I would explain to her what that means as I go through the assessment. So before I do the Bubble H though, I am going to listen to her breath sounds, because breath sounds are vital to do in a postpartum mother, and we want to make sure that they are just clear and equal. So you do it just how you would on a regular patient. Anterior and posterior and right for the middle lobe. So I would roll her and check her on the back side as well. Then I would go to the Bubble H. So first we would go ahead and we would start with her breasts. So I'm going to go ahead and bring her gown up and keep her bottom half covered. These are the gloves I'm going to be using. I'd want to go ahead and massage around the milk ducts, two-hand technique with doing it. And here you just want to ask the patient if it's soft, if she's having pain. You also want to make sure that you go up and do it through the armpit area, because they could have some tenderness there as well. I would also want to note that the nipples are intact and there is no bruising, and that the breasts were soft and non-tender for the patient. From there, we would go ahead and we would move to the uterus. Here, you would go ahead and feel a finger above the umbilicus, and you would use your two-hand technique to feel to make sure that the tone of her uterus is firm, and also assess to see if she is having any pain. When doing this and massaging the fundus, I would go ahead and I would teach the patient that she should massage her fundus for 1 minute every hour to help decrease the bleeding. From the uterus, I would then assess her bowel sounds. So I'd go to bowels, and I'd want to listen in all 4 quadrants just to make sure that they are active. This is really important to do in a postpartum mom who may have had a C-section as well, just to make sure that they are not developing an ileus. So you would want to ask them when they had their last bowel sound, or bowel movement, when they last had their bowel movement, if they're having difficulties, and you'd want to ask if they're passing gas, because that's typically the #1 sign for a mom to have prior to having her first bowel movement. Then we would go ahead and we would go to her bladder. And with the bladder, you would just want to ask when they avoided, if they were having any pain upon voiding, any bleeding, and you would also want to instruct them that every 2 hours they should be attempting to void to make sure that they are still pushing fluids and that they're not having an issue. If it's a post-C-section mother and she had a Foley pull-out, then it's even more important, because they need to assess that they are able to void, but so you do not have to recath them. Then from the bladder, we would go down to and assess the loci, which here I'm going to go ahead and put on my gloves. So this is when you're going to look at the pad. And looking at the pad, it's pretty saturated, and that you would want to take note of how much is in it. So it's about, I would say, 4 or 5 inches length and about 2.5 inches wide, and that it's red. So So that would be an indicator of how often the mom is bleeding. And you would want to ask the mom how often she is changing her pad, because if she is soaking through one pad in 1 hour, then that is too much, and she needs to call the doctor or the nurse, and they need to assess it farther to make sure that she is not hemorrhaging. With that, you would also want to assess for any odor. It should just be stale. You should not have any foul-smelling odor, because that could be a sign of an infection. And you also want to assess for clots. It is normal for mom to have maybe a few bloody clots like you would with your period, but you don't want it to be excessive, because that could also be a sign of a hemorrhage. And you also, on this part, would want to instruct the mom that the blood flow is going to be like a normal period. It's going to be bright red, and it's going to go to a dark red, to a brown, and then eventually just stop. So as that progresses, if it were to go back to red, she needs to go back to bed because she has too much activity. From the loci, then, you would go to the ECMO, or her episiotomy. So I would go ahead and I would want to turn the mom and help her turn on her side, which is going to be hard to do with this mannequin. But with doing that, you would want to assess for redness, edema, ecchymosis, so bruising, drainage, and that it's approximated. You would want to ask for if they're having any pain there, and with that, that's about all you need to do just to make sure that the incision is okay from the cut. Then we'd want to go ahead and we'd want to do the Holman's test on the mom. So I'm going to go ahead and take my gloves off. The Holman's test is to assess for DVTs. So you would go ahead and her foot would be pointed, and you would dorsiflex it back fast, and you would ask her then if she had any pain going up her calf. You would want to assess for warm streaks of red, because that could also be a sign that there is maybe a DVT. You can also then let the foot just kind of fall and see if she's having pain that way as well. This is also a good way to assess for clonus in the mother. Then as I'm assessing the patient, I would want to make note of her behavior, if she's crying, cooperative, talkative, what her mood is, to see how she is dealing with the postpartum, because the hormones can be a little crazy, and we just want to make sure that she is dealing with it well. So crying can be normal, but we just want to keep an eye on that. You would also want to then educate the patient on what we talked about, that they need to massage their fundus once an hour for a minute to decrease the bleeding. They need to urinate every 2 hours, and that if they soak through one pad in an hour, that is too much, and if they go back to red, they need to go back to bed because of too much activity that they are trying to do. After we talked about that, so then if it was a mother who had a C-section, there's not an incision on this patient, but the incision could be up here, and you'd want to make note of also redness, edema, ecchymosis. So it'd be right about here under, but there's not staples to show. And it could be, but you do redness, edema, ecchymosis, drainage, and approximation of the incision line. You would want to make note if it's staples or sutures, because it could be either, and just to assess the pain there as well. If they had a catheter or a PICC line, they typically, which this mannequin does not seem to, those typically come out 24 hours after the mom had a C-section, and you would just want to assess the incision site on both of those. Then with the epidural, you would, if a patient had the epidural, you'd want to turn them on their side to check that incision site, just to make sure that it is also free of redness and edema and all the other things you do for a normal incision. Afterwards, you could also ask the mom the questions about the teaching points, just to ensure that she understands that when too much bleeding is too much, what color change is not normal, how she can decrease her bleeding, and things like that, just as an overall education point. Thank you.